Hello and welcome. COVID-19 has raised many health concerns surrounding the conducting of research, including preventing researchers from traveling both internally and internationally for non-COVID-19 related research and work. One of the important tools of research is conducting field surveys, but most field surveys require close contact between enumerators and respondents. Moreover, some countries have enforced restrictions on movements or have recently relaxed restrictions, and questions still remain about whether lockdowns will return in some form in some countries. This touch-and-go nature of reopening may give researchers pause when deciding to field surveys. At the same time, survey research is particularly important for gathering information needed about citizens' knowledge about health precautions and perceptions of how governments are handling the outbreak. This conversation considers the health challenges of conducting surveys, as well as the opportunities to understand the impact of the virus and how citizens are interpreting their government's response. Welcome to Leaders of Africa Live, a conversation about conducting research surveys in the COVID-19 era. Leaders of Africa Live is interactive. Share your voice and join in the conversation in the chat, or join on Zoom, and feel free to call in at leadersofafrica.org/live or tweet using the hashtag #LeadersAfricaLive. Let us know where you are joining us from. Select comments and call-ins will be shared and discussed amongst myself and the panelists. We may all be in different locations today, but we are all here together virtually. It is so good to be with you. Before we get into today's conversation, I want to share a little bit about the current survey research that has come out. And in fact, we're going to meet some of the panelists who arranged and coordinated and managed the surveys I'm going to show. So let's start here. Public opinion data provides useful information about citizen demands for public goods and safety. In a recent survey conducted by the Institute of Public Opinion and Research, IPOR-Malawi, Malawians ranked COVID-19 quite low when it comes to the most important problems facing the country. Further, one of the conclusions is that a majority of Malawians do not fear COVID-19. But measuring public attitudes is not just about interpreting the perceptions of the virus and responses to it, as we see on your screen. We also care about opinions on recent political and economic developments that are really important to addressing the impacts of COVID-19. Take Malawi's presidential election rerun. IPOR-Malawi's pre-election survey provided insights into the high level of support for the court's annulment of the original presidential election results. And you can see that on the screen there. You see 80% of Malawians supported the court's decision to annul those original elections. Surveys can also give us useful information that can help in assessing the quality of the elections, including voter intentions. And we can see on your screen data from IPOR, again, looking at vote intentions ahead of the Malawian rerun of the election. And in fact, I should point out that IPOR-Malawi's survey results largely affected the official count of the rerun. There is also an opportunity to view COVID-19 and how it influences broader societal matters, including domestic and interpersonal violence, public trust, and social cohesion, as well as mental health stressors that we all know are quite important to understanding the broad effects that are present and related to COVID-19. And you can see on your screen some of the data we'll talk about today from the Africa Polling Institute on this subject of social cohesion, as well as issues of interpersonal and domestic violence that have been very important topic of discussion in this COVID-19 era. Policy making guided by pertinent and timely data is necessary, but the advent of COVID-19 has obviously raised some concerns with fielding surveys. So one option being explored is investing in preliminary steps to develop online panels, for example. But these efforts are still quite nascent in their efforts, and they're a good approach, and we're going to be talking about those today. But obviously, there are some methodological concerns about the selection of those samples. So we're going to talk about that a bit today. And even if surveys could be fielded in one country, and we're able to do it in one country on some of the topics I mentioned, obviously we are also interested in cross-national comparison results and the sharing of best practices. And we see some of the great work coming from Afrobarometer on this more cross-national front. So as we can see, there are a lot of different things going on when it comes to survey research today, and we're going to be discussing that with our esteemed and seasoned panel who conducted and managed some of the surveys that I just mentioned. So I want to welcome our panelists at this time. We are joined by, first of all, Professor Boniface Dulani, who is the Director of Surveys for Afrobarometer and a senior partner at IPOR-Malawi, which I've just mentioned some of the great data coming out of IPOR-Malawi. Bonnie recently led his team in conducting a election survey in Malawi and coordinated an election observation mission during elections. Some of the fruits of his work appear in the Monkey Cage at the Washington Post, just released in the past few days. I should also mention that Bonnie received his PhD at Michigan State University, same as myself, and therefore is a fellow Spartan. Bonnie joins us today from Malawi. Welcome to you, Bonnie. I think we're having a little bit of a connection issue with the audio there. Hold on one moment.
My apologies. I think I had muted myself so that you don't capture any noise from my end. My apologies. It's a pleasure to be on the panel, Peter, and go green, and also to link up and share some of our experiences in doing surveys during this COVID-19 pandemic period. But it's also a pleasure to meet my fellow panelists, who I'm sure you will be introducing in a moment.
Absolutely, and we're all hoping that only a muted mic is our only technical issue today with doing all this international communication. So I do want to welcome Dr. Bell Ihua, who is the Executive Director of Africa Polling Institute, that is API. He is also a Principal Consultant at DBI Analytics and Consulting and the Director of Smile Africa Group, a burgeoning Pan-African organization providing thought leadership and promoting investment in sub-Saharan Africa. He was actually also previously the Chief Executive Officer at NOI Polls in Nigeria. Bell joins us today from Nigeria. Welcome to you, Bell.
Thank you, Peter. It's great to be here. Thanks for inviting me to join this conversation. And I must say it's a pleasure being on the panel with the tall man from Zomba, Boniface Dulani. I want to officially congratulate him with the successful elections in Malawi, and obviously the results of the poll that they conducted, which they have been justified by the results that came out from the election. So congratulations, Boniface.
Thank you for the kind words, Bell. Thank you. We are all proud of Malawians for really, going out to vote in their large numbers, even if these are really very difficult and unique times.
Absolutely. And we're going to talk about the rerun at the end of today's conversation and have a discussion about that a little bit more. But I want to start with you, Bell, and I want to go straight to the heart of the matter. And obviously the global pandemic has had broad influences in a variety of different areas of the political life, of economic life, but also in terms of the research life that one has. And I just want to start with a broad question here to begin our conversation today. And I'm just curious, in your view and from your perspective in Nigeria, how has the global pandemic influenced your mindset when it comes to thinking about fielding surveys?
Thank you very much, Peter. Interestingly, I think a couple of months or so back, I wrote a piece, an opinion piece that was published about the role of opinion researchers in this COVID-19 era, and how, as researchers, we should begin to rethink research methodology and strategies to implementing research. The truth of the matter is that the COVID-19 pandemic has had their consequences on our space and our sector as opinion researchers or social researchers. with grave implications for how research is being now conducted in what we refer to as the new normal. So prior to now, and I'll take direct examples from our institute and the work that we're doing. We had quite a number of, assignments requiring field work, in-person, face-to-face field work. But immediately the whole COVID-19 pandemic became a global scare. We received calls from our clients requesting that some of the projects we had to be halted, and from other clients that we needed to reconsider our strategies for data collection. So yes, there've been huge implications, and if I should look at it from three perspectives: the core COVID-19 period, the easing up of the lockdown, and possibly having a peep into the post-COVID-19 era. We know that our ways of conducting surveys or social research in the past has changed, and it has changed for the best. We know that remote approaches for collecting data or virtual approaches have now become the order of the day. During the core COVID-19 era, we had instances where we had to resort to either telephonic interviews or online interviews or SMS interviews, more remote approaches to collecting data, as opposed to the face-to-face, in-person interviews. Of course, with these, there are different implications. With the telephone, you have to be talking about the telephone penetration rate of the country or the continent. With also online, you have to be talking about the internet or broadband penetration rate of the country and of the continent as well. So with each of these, there are more deeper implications that we definitely can discuss about.
I think that's a really important point you mentioned, Bell, about this different sort of phases of COVID-19. Sometimes we oftentimes sort of loop this whole COVID-19 era together, and obviously it's a very dynamic period. And so I'm curious, your sort of reflection on that, Bonnie. Have you seen sort of these different periods of time when it comes to conducting field research in Malawi, but also amongst some of the Afrobarometer partners? Has sort of things changed from perhaps at the beginning where things were sort of halted, people were a little bit hesitant, but then things started opening up when it came to doing field research? What did you see in your side, Bonnie?
Yeah, I think we've also gone through similar phases as Bell has just been discussing. I wanted to look at it from the continental perspective, especially from the Afrobarometer, because we are dealing with 36 African countries, and all these countries are different phases of the pandemic. You have countries that registered cases very early in the process, and when Afrobarometer made a decision to suspend fieldwork, we had countries that said, but look, we don't have COVID-19 in our countries, so why would you impose a blanket suspension of fieldwork activities across the continent? In some cases, actually, there was some pushback. I recall Mauritius, for example, asking us that, look, let us go ahead on our own to launch the survey. And I think in the process where we're discussing this, 3 days later, they registered their first case of COVID-19 and closed all borders and suspended all fieldwork and research activities. And of course, we have also had countries that have, I would say, a kind of a casual approach to COVID-19, and they've been allowing a fieldwork research to go on. And so you have this kind of clash now between international research protocols, and of course, as Afrobarometer, we always wanted to prioritize the safety of our research teams, as well as the safety of our survey respondents. So even when a country like, say, Tanzania, for instance, has been saying, look, we are okay, we are allowed you to go ahead with the field work, it's presented really challenges to Afrobarometer and I'm sure other researchers to say, okay, how do we handle a case like that where, the national partner organization and even the government says field research can go ahead, but then from where we sit, and looking at the number of cases, it makes you pretty hesitant that, well, we might be really putting people, at risk here, both the researchers as well as the respondents. Coming into Malawi, Malawi has had an interesting path in COVID-19 because we didn't record cases really of COVID-19 until early April, but the government introduced social distancing measures in mid-March, and basically placed restrictions in terms of whether how many people could gather in one place, and so on and so forth. And then at some point, the government decided to impose a lockdown, but this was rejected and I think dismissed in court. And so this has left it up to researchers like ourselves to make a decision on whether we can move to telephone surveys or indeed we can continue with the face-to-face surveys. And again, these all present really ethical dilemmas, because now the decision is on us. Do we, just because there is no lockdown, there are no restrictions to doing field work, is it safe for us to send our researchers out there? And when we send them, what is also the impact? Do we give them, protective equipment, to require them to wear face masks and all? And then if they go to rural areas where maybe people also get scared when they see people wearing face masks, they start thinking that, well, maybe these are the people, and I've had the cases where people say, hey, these are maybe the people who wanted to bring a COVID into our areas where maybe there have been no recorded cases of COVID-19.
I want to talk about that issue of how respondents may be responding to the surveyors themselves in just a moment. But I want to sort of build on something you talked about, Bonnie. You talked about the fact that Afrobarometer as a network was making decisions for the network overall, but some of the national partners may have said, well, things don't look so bad, or we have the space to do our survey. And as you're well aware, a lot of universities around the globe have different provisions about what their researchers can and cannot do these days, right? So for example, an institutional review board can say, well, you can do human subjects research, but it only has to be related to COVID-19. You can't be doing sort of non-essential types of research. So I'm curious to both you and Belle, are you seeing that from some of the international organizations and the universities that you've worked with, complications when it comes to differences between what some institutions are saying about what their researchers can do, and then what you feel you could do, or what national partners feel like they can do to the ground? So Bonnie, why don't you reflect on that? I'm curious to know.
Yes, we're very much, I think, facing that dilemma. And I'll give you a very good example of the recent survey that we did for the elections. This was a survey that we as an institution came up with a proposal and approached the Open Society Initiative for Southern Africa, who graciously enough gave us a grant to do the survey. And we did approach the Ministry of Health in Malawi to give us guidance, and the task force that is overseeing the COVID-19 fight in Malawi. And they gave us guidelines in terms of how we could go ahead with the face-to-face surveys, but of course with the protective equipment for our researchers, because we're also interested in gathering data on COVID-19 as well. And I think, as Bella alluded to, of course, people are looking at the option of telephone surveys, but in our case, only 52% of the country, at least from Afrobarometer surveys, tell us that they own mobile phones, and most of those might not always work. And I'm sure Bero will agree with me that doing telephone surveys, you really have to make hundreds and hundreds of calls just to get a small sample. Now, in this case, it was clear that to do a pre-election survey, on telephone wasn't really an ideal option, besides the fact that we didn't have access to a database of mobile numbers. But anyway, to cut a long story short, the Ministry of Health in Malawi and the COVID-19 task force in the country gave us a go-ahead and gave us the guidelines. But when we released the results of the survey, we did get quite a lot of pushback on social media from researchers elsewhere in Europe, in the United States, saying, how could you be doing a survey at this particular time? IRBs, institutional review boards would not approve studies like this. And we're saying, look, we are also guided by our own institutional review boards in Malawi, and they gave us the go-ahead. So why should we not go ahead with research here that has been approved by our own IRBs, just because the international IRB boards elsewhere are not approving research of this nature?
And so, Bell, building off of what Bonnie said about sort of this tension that may be there, and I like that point you made, Bonnie, about some of the judgments that are present, right? And you certainly get that feeling in some institutions that, you shouldn't be doing international work, even if you're given a local sort of go-ahead. And I really appreciate that reflection. So I'm curious, Bell, on your end, are you also seeing that in the same way from a lot of the clients that you worked with? You mentioned at the outset that a lot of clients were saying, well, let's delay things, let's modify things. So what is some of the pressure that you faced? What are some of the things you're hearing from your stakeholders?
Yes, I mean, from our own end, I think first things first, some of the clients we were working with, some of the international clients simply told us that we would have to hold off on all surveys and field work that had to do with their own projects. So because of that, we had to suspend projects for such clients. But there were other clients who required that we had some form of review of the methodological systems that we apply and look into what would work best at a time like this. So we had to put our cards on the table. We began to ask, what are the options we have? So first we have telephonic. Bonnie talked about the penetration in Malawi. Fortunately for Nigeria, the penetration is almost 100%. We have 184 million mobile phone subscribers. So that's a huge database. Yes, you can say it is not everybody, but at least it gives us a significant proportion of the people. Besides, we also have a good database that gives us access to mobile phone numbers across the states, across local government. So that helps us with a rich sampling frame from which we can randomly conduct those polls. Then we consider the issue of SMS polling. And of course, I know there have been a number of organizations that have come up with the idea of SMS polling, but we knew the inherent challenges. So at the moment, literacy levels in the country are just barely over 50%. So if you're going to go with telephonic polling or telephone survey, SMS surveys, you're going to be having challenges of literacy levels. You're going to be having challenges of what language are you going to conduct those SMS surveys in. You're going to also be having issues of respondents' apathy. So we found out that loads of Nigerian respondents do not care much about participating in SMS surveys, because SMS surveys will require them typing and yes or no, or typing 1 or 2, and will require them doing that several times. They are more comfortable with someone calling them in their local language and speaking to them, asking them questions. If it's not face-to-face, the telephonic one will go. But then we also have to look at the online platforms. What online options do we have? Is it possible to create questionnaires on platforms like, say, Google Forms or other online platforms like Survey2Go or Survey CTO, and send link of those platforms so that people can complete those platforms? Well, there are still inherent challenges with that, because the internet penetration rate of Nigeria is currently about 65.1%, is anticipated to hit about 70% by 2021. So definitely you have about 35% of the population still left out with that. And even for those who have access to the internet, it doesn't mean that they would be willing to complete your survey online. So we had these disparities, but then there were also international clients that sent us questionnaires, links of questionnaires for us to help disseminate. We tried our best to disseminate, but we knew that at a point, we had encountered, respondents' apathy towards completing lengthy, questionnaires from clients. But at least we had a couple of COVID-19 related surveys which we conducted using telephone. They went very well, and I'm sure I will have the opportunity to share some of the results we got from that endeavor.
Yeah, definitely. We're going to definitely talk about some of those results, giving us some preliminary look into how citizens are really understanding and interpreting the events related to COVID-19. But I want to before we get into even our discussion about the telephonic polls or online panels, I want to come back to sort of the in-person approach, Bonnie, that you've mentioned. And one of the things that strikes me about both you, Bonnie, and Bell is that you care very much about the quality of the data that is being produced. And I know, Bonnie, you talk a lot about how when you get the survey right, when you do the methodology correctly, you should be actually able to have a good estimate, right? And an estimate that in comparison to other estimates or other information out there, that it should be able to challenge it appropriately or corroborate it in some cases. And so obviously that involves to some degree this face-to-face engagements. And so I'm curious, Bonnie, from your perspective in thinking about doing surveys in the face-to-face approach, what are some things that IPOR-Malawi has done, as well as Afrobarometer is thinking about and doing, to ensure the safety of enumerators on the one hand, who are coming into contact, who are going into various communities, and also this thing that you mentioned before, how are they also communicating their presence to the local community, ensuring that the surveyor doesn't seem like some person coming from the urban areas to potentially infect the community with COVID-19, or perhaps is there to do some sort of medical experiment or something of this nature. So what is being done to protect the enumerators and build trust that is needed to conduct surveys, particularly in face-to-face environments?
Yeah, you're right that one obviously needs to, again, prioritize the safety of both the researchers as well as the respondents. Afrobarometer has adopted a very deliberative process in terms of what kind of steps we will take to resume surveys after COVID-19. And I think one of the areas we are looking at is also to look at the prevalence rate and if there's been a reduction in the number of confirmed COVID-19 cases. But more importantly, to test whether we think we can send enumerators in either with protective mask or not, and to see also the effects, the more effects of that on a respondent, the kind of responses we get. Afrobarometer is actually currently exploring options of doing a kind of a comparative study in countries that have less COVID-19 cases, where we can then send enumerators out to interview respondents, just a small number of respondents with face masks, and then another group, another set without face masks. But of course, that carries in itself inherent risks, because if we are sending people without face masks, we don't want also to get a situation where our enumerators catch COVID-19 in the course of their work, or indeed, they transmit transmit COVID-19 to unsuspecting respondents. So we are deliberately slow in going out with that kind of experiment, if you may call it. But that is ultimately what Afrobarometer is going to do before we resume field work, so that we can also get data in terms of what is the effect of protective clothing on respondents. From the IPO side, as I said, we've actually sent out enumerators before with the face masks, and in some cases there was a major pushback from local communities when they saw, people coming in a 4x4 SUV, all dressed up covered with the face masks and all, because there's also been some narrative especially in the rural areas of Malawi about COVID-19 as being, some people think that is something that is there, but it's not reached their communities. So, but that the government is trying to create cases where there are none. So we've asked our enumerators as well to approach local leaders at the district level, so government officials, the police, as well as local traditional leaders, before they go out in the communities, so that they can at least get an understanding of what is acceptable and what is not acceptable at that communal level before they go out to start to talk to individual respondents. But these are all things that we are now being forced to learn very quickly because of COVID-19. I mean, so it's also a learning process on our part and on the side of our enumerators. So we've also, invited officials from the Ministry of Health to speak to our enumerators in terms of how they can keep themselves safe, so that if they don't have a face mask, for example, they should ensure that at least there is some social distancing between themselves and the respondents, so that they don't just sit next to each other. I mean, like speaking and speaking into each other's mouths, but at least allowing for at least 2-meter distance when they are interviewing respondents, so that everyone can be safe.
And so, Bonnie, I just want to ask you a quick follow-up. Has Afrobarometer thought about the kind of language that they're going to be including at the beginning of the survey? Obviously, when you go to the respondent, there's that template, like, hello, my name is, this is where I'm from, this is what we're doing, and a little bit about the survey. Is there also sort of talk about including certain language at the beginning of the survey to kind of put people's minds at ease? And if so, what does that language kind of look like? And what's your thought about including some of that at the beginning of the survey when you're engaging respondents?
Well, I think that's something that's under consideration, but we have not even gone very far in terms of running that experiment, because it's only recently that we've been given a go-ahead from the Afrobarometer board to say, okay, we can now start developing a protocol for resuming field work activities, and then what kind of steps we need to be following up when we get to the local communities. We are actually having a meeting on Monday with the project managers across the entire Afrobarometer network, where we will be discussing this kind of issues, including the introductions that we will be, the modifications to our introductions at the beginning of surveys that you are asking about. So maybe this webinar came in too soon. If it come in next week, same day next week, I would have had a clear response for you. But that's something that we will make a decision on as a collective rather than as an individual.
Wonderful. And Belle, to you, sort of building on this discussion of keeping enumerators safe. In your mind, what are some of the steps that should be done? We see Bonnie reflecting on his experience both in Malawi, but also the thought process of the Afrobarometer and the Afrobarometer network. What is your thought process like when it comes to ensuring that the enumerators are safe, and also ensuring that you're communicating that to some of the partners that are running the surveys when their minds need to be sort of put at ease about some of these precautions?
I think our position is not different from what Bonnie has initiated. We at API are already putting together protocols for field work to commence post-COVID. In Nigeria, we had a very peculiar situation as the president had imposed a compulsory lockdown on the country. So within the context of the lockdown, there was in no way anyone could move around on any data collection endeavor, except they were providing essential services like health workers, medical workers, or those providing delivery of economic palliatives and food to, the vulnerable and poor citizens. But beyond that, there was a total lockdown. And what we applied during that time was to even conduct surveys remotely. So we had over 50 enumerators working off their homes and working off like Survey CTO and Survey to Go. And with such platforms, you could have a data manager at the back end looking at the data. Every time each data came in, you can go in and take a look at the data and see what is happening. So, and that's why I divided this into the three phases. But now with the easing of the lockdown, only early this week, the government has now given permission for interstate travel. Prior to now, the lockdown had been eased up a little bit, but you could only move around your particular state. But now, the government has allowed for interstate travel, meaning people can travel from one state to another, but the airports are not yet open. So we have to put in all this into consideration. But by and large, looking at the first COVID-19 era, then we would have to resume field work. I think very much, of course, and strategies for engaging respondents. So respondents, just as Bonnie said, have to be engaged with clear social distancing rules in mind, have to be engaged also with personal protective equipment. At least every respondent has to even have hand sanitizers with them while going to the field so that they can sanitize. They can even share with the respondents while they're on the field. So these are some of the protocols that we are currently putting into place, envisaging that when the full opening up of the country and the economy is allowed for face-to-face, in-person field work to commence, we would have this in place to be able to ensure safety of our enumerators as well as safety for the respondents.
It's wonderful. I think that's a really good and important sort of perspective on this issue of maintaining that safety that is necessary. And I think this is a really important thing. And I think international researchers are really looking at some of those approaches to doing surveys that will make them feel good from a liability and from their own sort of ethical perspective, but also ensure that the communities are also respected in this process. And I think it seems like we have a lot of consensus in terms of some of the steps that are necessary, particularly on the in-person process of conducting surveys. But I like how, Bonnie, you mentioned it's a learning experience, and that we're currently in right now. I want to turn a little bit now to surveys that you've done and some of the data that you've collected on COVID-19 and how citizens are responding to the precautions that are present, the government responses that have been organized, or in some cases not so much organized. And I want to get a sort of a feel for that. And I want to start with you, Belle. You've mentioned that you've been doing some current work related to COVID-19. So why don't you give our audience a good sort of overview of some of these surveys that you've been doing in this area, and then we'll go from there. So just to introduce us a little bit to some of those surveys.
Okay, thanks, Peter. We have done quite a number of surveys, at least in the last 3-4 months. We have done about 5 surveys. A couple of them are for the international development organizations where we didn't have access to the data, but we have conducted at least one at a state level where we have access to the data. So basically, we're trying to understand citizens' perception regarding the reality and the existence of COVID-19, as well as precautionary measures they are taking to curb the spread of the virus. So in terms of the reality of COVID-19, this was conducted in one of the states in southeast Nigeria. And we conducted a statewide survey using our telephone samples, and we collected over 1,000, 1,000 interviews were conducted, speaking to different people in the different local governments to ensure robustness and representation of the entire state. I can say from that survey we conducted, at least we had 5 major findings which we could allude to. So one is the fact that at least 82% of those we interviewed agree that COVID-19 is real. 82% agree that COVID-19 is real, while 18% say they don't think it's real. However, amongst the 82% that even agree that COVID-19 is real, a large proportion of that, almost 70%, do not agree that COVID-19 exists in their particular state. And the reason for this is because they have not been shown evidence. So they say they have not been watching videos or seen photographic images of citizens in their state who are in the isolation center and are victims of COVID-19. So because of that, much as they think COVID-19 is real, because of what they see from the international media and the traditional and the social media, what they hear, but as far as it is regarding to their states, they feel that it's not, it's not real in their state. However, talking about the effectiveness of the use of face masks, hand washing, use of hand sanitizers, at least we have on average about 86% of those we interviewed saying that these are all effective means of curbing the spread of COVID-19. However, there are challenges. So the issue of purchase of face masks and purchase of hand sanitizers would cost, would place a financial burdens on them, especially those in the rural area. They are barely struggling to survive and they do not have money to buy face masks or hand sanitizers. But then we also saw a situation where in some instances, even the issue of hand washing is been difficult because some communities do not have water. They have to go a distance to get water, So talking about washing your hands under running water in such a situation is difficult. Then, of course, we had the issue of the limited capacity of the testing. So testing for COVID-19. So we had at least 92% of those we interviewed saying that they have neither been tested nor do they know anyone that have been tested. And this talks about the slow pace of tests that is currently available in the country. Of course, with a population of almost 200 million, the test facility that we have on ground is simply not enough to capture the number of people. So it's talking about how can we expand the test facility in such states, especially at the rural level, with test kits so that people can be tested. And I think another important issue to point out is the issue of the willingness to go for a COVID-19 test. So we asked the question, will you be willing to go for a COVID-19 test? About 70% of those we interviewed said yes, they'll be willing to go for a COVID-19 test because they don't want to be caught unawares. They don't want to just find out that they are ill or they may pass on and die because they did not know that they had COVID-19. But then you had about 19%, almost 20% not willing, or those who are simply unsure. And the reason they're not willing is because they feel that if they go to the hospital, even simply because they have malaria, they can be told they have COVID-19 because the symptoms of malaria are exactly the symptoms of COVID-19. And finally, you have the situation of economic palliatives. We found out that only 19% of those we interviewed said they had received any form of economic palliatives from the government, and the palliative were looking at food stuff, food items, 96%. 2% said they received some form of cash palliatives. 1% said they received some face masks. Another 1% received some hand sanitizers. Mm-hmm. But there were allegations of corruption in the distribution of those, those palliatives. There were those who alleged that the palliatives were distributed by political party affiliation or tribal sentiments, and that it would have been good if palliatives were distributed freely in spite of whatever political affiliation people had or whatever tribe they came from. So these are just a few of what we gathered from the data we collected and the survey we conducted on COVID-19.
Wonderful summary, Bell, and I want to talk about that issue of perceptions of corruption in the context of COVID-19 in just a bit, because I know Bonnie has, in a recent podcast, was talking about this issue, and I want to go there in a minute. I just want to have you reflect a little bit, Bonnie, on your recent results from IPOR, and I'm going to put those on the screen again because it's been a little bit of time since I showed those here. So you can see this comes from the Twitter feed, so feel free to follow IPOR on Twitter and its platforms at IPOR-Malawi. You can see that at the bottom there. This comes from their Twitter feed, sharing some of the results of their survey. This was a question that asked about most important problems. It's a question that is common on other surveys, including the Afrobarometer survey. And then citizens will list, their most important problems, say, for example, list their top 3. And then that is compiled here. And then we see COVID-19 there at rank number 7. And all the way at the top is food shortage and famine, followed by management of the economy, followed by farming and agriculture. So there's sort of an agriculture food security theme there, with the economy also being important there. So Bonnie, why don't you take us through some of these results, and what do you think is really behind these results, and in particular the placement of COVID-19? Is COVID-19 still a concern, but citizens are more concerned with the effects of COVID-19, or is there something else at work here?
Thanks. We've actually done 2 large studies on COVID-19. The first one, I think, is a study that we've done with the program on local governance and development at the University of Gothenburg. That was actually a large study. We did a survey of about 4,500 respondents by telephone, and that was our national coverage. I just wanted to highlight that because to actually get to that total of 4,500 respondents, we had to call almost 10,000 respondents, and some of them really calling multiple times to be able to get to achieve that kind of response rate. And then, the other study that we've done, and I think it includes the results that you have on the screen, Peter, is the face-to-face survey that was part of our pre-election survey module. And as I said, I think we had coordinated with the Ministry of Health and to include questions on COVID-19 in that survey as well. So in the telephone survey with the GRD program at the University of Gothenburg, we looked at several dimensions. That's like Bell has pointed out. There is widespread knowledge and understanding of the existence of COVID-19. But I think an earlier slide that you also presented, Peter, highlighted the fact that Malawians don't say that they're not as scared of COVID-19 as much as they are scared of hunger. And I think that 81% really perhaps explains the other slide that you just showed just now. It's not because Malawians they are aware of COVID-19. And in our surveys, again, almost 9 in 10 tell us that this is a serious issue and it needs to be handled with all the seriousness that it deserves. But then at the same time, people are also telling us that, look, if we also just go and hunker up and lock ourselves down in our homes, then there's more likelihood that we might die of hunger than of dying of COVID-19. And this was also reflected actually in our context when government tried to impose a national lockdown. There was spontaneous demonstrations across the country protesting the imposition of a lockdown, especially that there was no accompanying safety nets that were being proposed by government. So Malawians were telling us that, so what, how are we going to survive if you do not give us any support to survive the lockdown? And as a result, that's why we see perhaps Malawians saying, let's prioritize hunger, and food shortages. And the COVID-19, yes, is there, but we might die of hunger first, maybe before we die of COVID-19. And actually, one of the questions that we've asked in our surveys is also to see how serious do people think COVID-19 is. And again, about 3/4 tell us that, COVID-19 is serious, yes. A lot of people are likely to get it, but they also tell us very few people will die of COVID-19. And I think that might explain why we are seeing people not prioritizing COVID-19 as an area that government should be addressing, instead telling the government that focus on hunger and food shortages. This is a bread and butter issue. But of course, I also think that some of these responses might be a reflection on the number of COVID-19 cases in the country. I think at the time when we did our surveys, we had less than 300 confirmed cases in Malawi. So for most people, COVID-19 was something very distant. But when it came to hunger, this is something that they've been living with. And I just wanted to sort of highlight one interesting finding from our survey with the Governance for Local Development program that perhaps is different from what Bero was highlighting in terms of willingness of people to go and get tested. In our studies, actually, we find that there is less willingness for people to go and get tested, in part because they tell us that, well, there is likely to be stigma attached to being found to be COVID-19 positive. So a lot of people don't want to be said to go get tested because they are saying, look, there is going to be a lot of stigma. People will basically shun us, and we've actually seen that in one case it was a family that I think had unfortunately, one family member had COVID-19 and passed on. And when that family was put in quarantine, no one was willing to even sell them any food. They would go to shops. They would send some people to go to shops on their behalf. And again, no shops were willing to open up for them. And I think that's part of that dilemma that we see in our case, why people say they don't want to get tested. But otherwise, some of our findings are similar to what Bella has highlighted. I think one also interesting thing in our case, of course, is that COVID-19, the fight against COVID-19 has been, fought against a background of an election campaign period. And we've had basically politicians out on the campaign trail ignoring all the social distancing regulations, and then to tell people to take something seriously when the politicians themselves were not treating it as a serious issue. Again, it's not surprising for me that we actually see just 3% of our respondents saying that COVID-19 should be a government priority. And I should also say that about 3/4 of our survey respondents said that the elections should go ahead, because we did ask as well that whether the elections should have been postponed given the COVID-19 pandemic. But 3/4 said yes, the elections should go ahead, and about 2/3 said even the campaigns for the elections should have gone ahead despite COVID-19.
And I think that important point about the stigma attached is something that has been reflected elsewhere. I know in Kenya there were a number of incidences of citizens that were identified in public spaces as having COVID-19, and then thereafter being antagonized by on social media and also in their local communities as well. And Bell, I think that's an interesting contrast that Bonnie has raised. So in the Nigerian context, was that something you were also looking at and thinking about when you were analyzing the results? Is the effect of in a sense a stigma around being COVID-19 positive, quote unquote?
Yeah, I mean, we got some evidence of stigma from our survey as well. But just as I said, and I think a very important point that Bonnie raised, which we saw from our data, was the fact that people were asking themselves the question, do I want to die out of hunger or do I want to die out of COVID-19? And for many of the people, especially those who earn their daily incomes from their daily, if you call it hustle, they have to be on the streets on a daily basis to generate their income. These are really trying times. But the beauty of it for us is that there was some effort by the government to provide some palliatives, some food from the Food Reserve Bank. But then again, whether this got down to the, to the really vulnerable and poor people who actually need this is a different matter entirely. As I said, there were allegations of corruption even in the spread of that. There were instances where, women who we consider really vulnerable and also young people were, saying they didn't have access to those economic palliatives that were provided. But I say yes on the issue of the, the stigmatization. But I think for us, what was most important, I know Bonnie touched on the fact that you had to make up to 10,000 calls to be able to get a 4,005. Well, I can say in our case, we had to make more calls. So to get 5,000 calls, we probably have to call 15,000, numbers to be able to get that. For our case, there are these are peculiarities of conducting telephone surveys that we just have to work with. At least we have up to 4 or 5 different cases that, when you call someone on the telephone to tell them about a survey, first they think it's a, fraud call, what we call in our Nigerian context, a 419 call, and, the odds are that they put up their guards. Then secondly, some people think it's some people think it's a juju call, a ritual. These are ritualists calling, you have to be careful. Then of course, we have the challenge of sometimes poor telecoms network that affect, your ability to make, administer those interviews effectively. And of course, you have the issue of simply apathy towards telephone interviews. If a man is hungry and you're calling him, telling him that you want to conduct a telephone interview, that's the last thing he needs or she needs. And, so these are some of the issues with conducting telephone surveys. But in any case, we still have to find a way around it because the country was on full lockdown. Nobody could go against the instructions of the president. But then, now with the current easing, we know that, we would now be able to consider resuming, face-to-face, in-person interviews anytime soon. And as Bonnie says, it's a learning curve for us, and we're also looking to see how that develops moving forward.
Yeah, and and Bell, earlier, I want to come back to that point about corruption, but something else is on my mind these days, which is the issue of misinformation. And we've been talking a little bit about it in the context of COVID-19 indirectly, but I want to talk about it more precisely, and perhaps how you are thinking about that and how we may be able to sort of get at that through surveys. And as you know, the issue of 5G, for example, was one of these discussions and pieces of misinformation that proliferated in not just in Nigeria, but in a number of countries as well. This sort of conspiracy piece. We already know before COVID-19 that the issue of misinformation has been very concerning, particularly in a broader political context as well. And so I'm curious, Bell, in terms of getting at information and sort of interpreting the results about how people are getting their information about COVID-19 and interpreting it, is there any clues as to, this issue of proliferation of misinformation, or how citizens are interpreting information, either true information that isn't true or in fact is true and helpful?
I mean, Peter, you're absolutely right. Misinformation, disinformation, fake news is a big issue here. We cannot overemphasize the import of misinformation in Nigeria because the role social media has, been playing is that these days you can get an information off social media, or you can get an information off your WhatsApp, and you cannot tell how credible that information is. And if you have not been trained to query the source of certain information, you may find yourself in this, quagmire. So, for example, when COVID-19 kicked off, we had a situation where all manner of people were prescribing all manner of, drugs or herbal remedies as solutions to COVID-19. Take this vegetable, take bitter cola. Some people even went to the extent of telling neighbors, you can have your bath with kerosene or have your bath with something. I can tell you misinformation and disinformation were big issues. But the one that really got out of hand was the issue of the chloroquine. When the United States government announced that, chloroquine can serve in some ways to treat COVID-19, all the pharmacies in the countries ran out of chloroquine because people just went to the shop, give us chloroquine, without even understanding what is the right dose and all of that from which they can, administer. So I think it's a big issue, but then what we should be talking about is how do people get information? So we've done several surveys in the past to ask about how do people get information. Even in this survey, I talked about, I think we saw clearly that the traditional media still plays a role, especially in the rural areas. Radio is the biggest means of getting information. And we also found out that apart from radio, we had those community, what we call the community radio stations. So various communities have something they call their radio house, where they have a loudspeaker and can help broadcast some information, or even something as basic as local town criers carrying their gongs around communities to pass on information. But then on a larger scale, the role of radio cannot be overemphasized. The role of social media as well is beginning to, as you know, social media on the continent now is big. Twitter, Facebook, WhatsApp, these platforms are now platforms for disseminating information. And as long as there can be, ways where we can control and manage that information that's going out on these platforms are credible, they are still the best bets to disseminate information to the people.
Yeah, and I know Afrobarometer has released some public releases related on a lot of different subjects, including, this issue of ownership. What do people have ownership of? Do they have a radio? Do they have a TV? And then how that sort of factors into the dissemination processes of information and the use of social media as well. And I think that's an important contribution that surveys have. Even outside of the COVID-19 era, perhaps, is giving us a baseline for how people are interacting with the information and the conduits of information that are there. The other thing, Bonnie, and you mentioned this on the podcast really recently with Dan Bannock, this issue of corruption. And obviously, Afrobarometer always asks the question, how many people do you perceive as engaging in corruption? All of them, some of them, and other sort of questions that get at this concept of the perceptions of corruption. And so in Malawi and some of the work that you've done, and are you seeing people acknowledging or concerned about a potential increase of corruption that may surround COVID-19? I know in the podcast you talked about how politicians and other people have been talking about the opportunities that COVID-19 presents them. Are citizens, seeing that? Are they interpreting that in any way? What do you see in that area of the perceptions of corruption and how they may be changing or staying the same?
Yeah, I think one also has to contextualize this within an electoral campaign environment. So yes, a lot of Malawians fear that COVID-19, at least this is what our surveys, especially the 0D study that we did, shows clearly that Malawians are very, very worried that politicians will use COVID-19 as a political football and as an opportunity for corruption. And indeed, we've seen that on the campaign trail with some of the opposition, especially our task force, discussing, and I think in an open and hot mic, discussing openly that, how much, should they be how much allowances should they be getting for themselves from their work as in leading the fight against COVID-19. Unfortunately for them, that gets captured on video, and very quickly it goes viral on social media that everyone gets to see this, and it just feeds into it's no longer a perception, it becomes a reality that this is what we thought these politicians were going to do, and this is exactly what they are doing. So in that sense, maybe it's not just misinformation, it's actually going to confirm what people's fears were already, and they actually see that both visually and can listen to it as well.
So you've mentioned throughout our conversation, and I think it's a really important point in the case of Malawi, that a lot of the COVID-19 developments have happened in the context of an election process, and I should say a very long election process if we start from when it began some time ago. And so I want to sort of hear your thoughts on this, because one of the important things in the outset I talked about was the importance of doing survey to gather data on relevant political and economic developments. And nowhere is some of this information more important than surrounding electoral processes. And as everyone knows, over 60 plus election processes around the world have been delayed in some form, some indefinitely, some for a few weeks or a few months. And so we see this delay of elections. And we know that eventually elections have to continue in some form, and obviously the quality may vary. And so I want you to reflect a little bit, Bonnie, on this, on what you saw in terms of the results in the Malawian elections. And I want to put that on our screen here so you can see this is the piece that was going around looking at the total amount and then comparing that to the outcome. And so, Bonnie, take us through some of these results and how you sort of interpreted these results you were getting in the pre-election survey.
Yeah, so as you pointed out, I think we've had this long and protracted election process that started actually in 2019 when we had our regular election in May of 2019, but then the two losing candidates challenged the result in court, and then the Constitutional Court ruled on the 3rd of February this year that there were just way too many irregularities, and that the result from that election of 2019 just couldn't be seen as reflective of the will of the people. So the Constitutional Court ordered a fresh election to be held within 150 days. The Electoral Commission and the president, at least that had been declared victor in 2019, challenged that decision in the Supreme Court, but the Supreme Court ultimately upheld the decision of the Constitutional Court to cancel the election and hold a fresh one. I should also add that one of the decisions, one of the momentous decisions that came out of that court ruling was also that Malawi should use the threshold for determining victors should be absolute majority of at least 50% plus one. Until then, Malawi had just used a simple plurality, and the winning candidate in the annulled election won by 38% of the vote. So we've seen now, as a result of that ruling, political parties entering into alliances so that they could master that 50% plus one majority. Of course, as you're showing on the screen there, majorities again of Malawians agreed with that court ruling that the election indeed should be held again and the fresh one should be held. 80% telling us that they agreed with that ruling. So, we've had a very short actually campaign period because of the court cases and then government trying to fight COVID-19 and at the same time look and focus at the election. So at some point the government was saying that, look, we just don't have the resources to divert towards an election again when there's COVID-19 to fight. It should also be said that in my considered view, one of the challenges of government fighting a pandemic, a healthy pandemic like COVID-19, was demonstrated in our case. Because if you have a government whose legitimacy was questioned by a majority of the population, it became very difficult for the government to mount an effective campaign against COVID-19. So that's why we see majorities maybe saying, let's have the election done, and maybe after that we can focus the fight on COVID-19. And of course, our survey showed that the majority, at least a majority, said they would vote for the then opposition candidates. And after making adjustments for undecided voters and the reticent voters, we concluded that we concluded that at least the opposition candidate, the opposition alliance candidate then at the time would secure 58% of the vote against 38% of the vote for the then incumbent. And I'm proud to say, actually, the winning candidate indeed got 58% of the vote against 39% for the incumbent president. So we really got the result. We got the result right, and we feel, I think, at a time when I know elsewhere opinion polling, there have been question marks about how precise opinion polling is. What this shows us is not when we do these things right, there is still a role to play for opinion polling. And I know that there are quite a lot of people on the continent and elsewhere that are well vested in terms of investing and making sure that the work is done and is done well. So we feel that this is not just a victory for Malawi, but I think for our fellow colleagues that are doing a similar work across the continent and elsewhere.
Yeah, I think that's a really important point, Bonnie, that you raise. And we had an earlier conversation about a month ago on Leaders of Africa Live about elections in COVID-19. And we talked a lot about election observation in that discussion. And one of the things that came out of that discussion was the fact that election observers, particularly international observers, are going to find it hard to travel to some contexts because of the health and safety precautions, which limits this ability for things like parallel vote tabulation and other sort of support that elections may get. And so in the context of having good public opinion data in advance of the election, that allows you, in a sense, another form of election observation or monitoring of the process and information that one could use to judge quality, to think about perceptions of election quality from a different angle. So I think that that is an important point. And I should also point out that, and I mentioned at the outset, that you also had a small election observation mission. What did that look like, Bonnie? What was that mission?
Yeah, so this was another interesting aspect, and it actually, links to your point about international observers, because last year's announced election, where most international observers said that election was free and fair. So when the Constitutional Court decided to annul that election, a lot of Malawians felt that the value addition of international observers is perhaps exaggerated, if I may put it mildly. I think, generally speaking, a lot of Malawians felt let down by the international observers that they upheld an election that was ultimately annulled by the courts. So even in our survey, many Malawians actually felt that the most important players in the electoral, in the election process should be political party observers, and followed by domestic observers. International observers came a very distant third. And so as IPOR, we decided, given that there were no international observers, so we decided to put up a team of observers, in all the districts of the country, and this went around on election day just to observe how the election was going, in terms of availability of materials for voting. But we were also interested in finding out how COVID-19 was being treated on election day. The Electoral Commission did provide face masks and hand washing facilities at the polling stations, but while maybe about half of the electoral staff were wearing their face mask, most of them were just really putting them around their necks There were very, very few voters that we noticed that were wearing face masks of any sort, or indeed, observing social distancing guidelines. So this is something that I think we were interested in, also in trying to understand how do you do an election within, within a context of a health pandemic, and that's, I think, something that we were interested in from an academic perspective. So we are actually working on a paper that is looking at that particular dimension.
That's wonderful to hear. And obviously, I know Bell mentioned this at the outset, that this is a really historic decision that Malawi's court took. Just want to emphasize that, because I know our audience isn't just Malawians, but is coming from all over. But it was a really important decision, building on some of the precedents in other countries, such as Kenya, where there was an annulment of a presidential election in the past, but not quite the same result as we saw in Malawi. Very different in terms of the actual outcome of the process. So I want to highlight that. To you, Bell, moving on from the political side, I want to close today with a couple questions about sort of broader societal issues and how surveys fit in. And obviously our audience is present. They've been sending us some comments, so I've been hopefully reflecting some of their comments in our questions to you. But Bell, you've done some really interesting work related to mental health in Nigeria. And recently, in the last month or two, you held also a Twitter chat that would highlight some of the pieces of this assessment of mental health issues. And obviously, we know that COVID-19 has had ramifications for mental health, particularly in countries that had very severe lockdowns, right? As you mentioned earlier, in Nigeria, the lockdown was very stringent in comparison to other countries that approach it in very different ways. And so I'm curious, from your perspective, what can we glean from that survey, and what can that help us understand for some of the interventions that may need to take place when it comes to issues of personal health and of people's mental health as well?
Well, thank you very much, Peter. I think, once again, what's most important to understand is the fact that COVID-19 had severe implications on the mental health of the citizens. We found out, for example, from the work that we've done in the past, that the mere going out to work and returning home was maybe more like a therapy, if I may use that word, to many people, and keeping them at home and not allowing them go out had severe implications on, their mood, on their emotions, and on their general well-being. We saw this in the part of the work that was done on my other front, the trust, is the fact that many of the young people that we spoke with, said the fact that they couldn't go out, they couldn't see friends, they couldn't socialize, had tremendous impact on them. In fact, some of them were of the opinion that the government should quickly lift up the lockdown, because the longer they stay at home, the more they think that something unexpected may happen. We also saw, as a result of this lockdown, that there was a huge spike in criminal activities. So crime rates went up. We found out that in this period of lockdown, there's been a spike in domestic violence, there's been a spike in issues such as rape, and there's been a spike in general, petty robbery and stealing in the areas. There have been anecdotal stories about people who have been caught and who have said they are hungry, and that's why they go out. And there have been anecdotal stories about those who say because they find out that they are jobless, and trying to portray the statement that the idle mind is the devil's workshop. But by and large, in Lagos, I think specifically, we had an incident of where a group of young men and women called the 1 million boys. In some areas, they call them 1 million boys. In other areas, they call them 10 million boys. have taken to the streets, have taken to the communities to inflict harm on fellow citizens and loot their property because of this whole COVID-19 lockdown situation. So yes, there's been a spike in crime rate. There's been a spike also in issues related to mental health. And that is why it's important that, as part of this conversation, we have also made, interactions and engagements with government, that a lot more needs to be done in order to integrate the mental well-being into the whole COVID-19 framework. It's not just about saying everyone stay at home, we'll provide you food, or we'll provide you sanitizers and face masks. It is beyond that. There's the emotional consideration, the mental health and well-being consideration, which is not being considered by government. The only people who are looking into some of that now and providing psychosocial support are some of the NGOs and the development organization. But beyond the NGOs, we believe it needs to move beyond that foray into a much larger scale. Incidentally, we are currently working on a collaboration with one of the leading mental health institutions in the country, the Mentally Aware in Nigeria Initiative, MANI, where we're working on a collaboration to do a much deeper study on the implication of COVID-19 on mental health of Nigerians. But overall, we've seen from anecdotal evidences that COVID-19 has had very severe implications on the emotion and general well-being of citizens.
Absolutely. What I love about this discussion that we're having here is that whether it's on the political, electoral side, or as you said, Bell, the importance of interpersonal violence, domestic violence, mental health, this important role of surveys, and both of you have cited results from surveys, is really important because I think it includes citizens' voice in the conversation, or at least allows policymakers and those in political power perhaps to reflect a bit. They may not always reflect on it, but at least allow them to reflect, allow them the information to reflect a bit on the policies and approaches that they're taking in these important areas associated with COVID-19 and regular political processes and social processes. As we close today, and we're up against time, but I have one last question. I think this question goes to both of you, and I want to start with you, Bell. If you could conduct, right, let's leave aside, partners that you may have or organizations you may be partnering, just you yourself, Bell, and the Africa Polling Institute. I think I'm going to come to you, Bonnie, in a moment with this question. If you could conduct your sort of ideal survey at this given point in time, right, in the context of Nigeria at this point in time, what are some of the key questions that you would want to include on that survey? And I'm curious as to what those questions would be, and perhaps a little insight why those would be the important questions to ask.
Thank you very much, Peter. Thanks again for the opportunity. I think first things first, it's important to understand that for governance to be effective, it has to be participatory. What public opinion polling and survey does is that it allows for inclusion and participation of the general public and ordinary citizens into the work that government is doing and give them an opportunity to appraise or assess the effectiveness of government. So, in the larger context, we cannot overemphasize the importance of surveys and public opinion polls. But coming specifically to the question you asked in terms of what is the kind of question we'll be asking in current surveys, I think for us here in Nigeria, the bigger picture are issues around the economy. The economy, we know it is currently down. The country is almost getting into a recession. And for us, it's about how are ordinary Nigerians going to survive with a recession in the era of COVID-19. We've also seen numbers. We talked about corruption earlier. There's a huge perception that there's corruption going on in government in the era of COVID-19 because, citizens hear about the billions and billions and billions of naira that have been released as part of COVID-19 intervention fund, part of that fund is supposed to be for economic palliative, and they say we are not receiving anything, our neighbors are not receiving, so we really do not know where the resources are going. So for us, I think surveys at this point in time should focus on the economic well-being of the citizens as well as their mental well-being. Citizens need to be empowered to inform government about the policies that they are putting in place and help government to think around the best possible measures to help, cover issues that have to do with hunger, issues that have to do with poverty, and especially issues that have to do with unemployment. Because of the current rate of unemployment, crime rate is high, and you cannot, the foreign direct investments have been, reduced since the COVID-19 era. So these are some of the issues for us that are of key importance that we need to consider at this point in time.
Absolutely, and I just want to throw in a couple of comments from the audience briefly here at the end. We have one comment coming from Pascal Moshe. He's wondering about, and I think this is an interesting question, how about children's perspective or people who are under the age of 18, right? Obviously, most of the surveys that we're all conducting are focused on youth, but youth of a certain age, right? Usually above 18, and then however we cap youth, 35, something like that. So does anyone want to reflect on that comment very quickly before I go to you? Bonnie, you said you had a reaction.
I want to jump on that. I want to jump, because when you actually asked that question, that's where I was also heading to. Because before coming, to this podcast, to this webinar, I was discussing this issue with my son. He's 14, and there is an ongoing debate on whether schools should reopen. And I was telling him that, I talked to a colleague from South Africa yesterday, and she told me that the government essentially has just said, look, let's accept we will live with the COVID-19 for the foreseeable future. So we cannot afford to have schools closed indefinitely. So I was making this argument with my wife. I was telling this point to my wife that I think, yes, the kids should indeed go back to school. And my son really, had very strong views against that. He said, look, it seems like these discussions are just about you grown-ups. You don't seem to care about us, that if you reopen schools, you are going to be putting us at greater risk. So, there is that kind of discussion. So I was thinking that, okay, so, at what point do we accept that we have to live with COVID-19 and then life has to return to normal? But is that life returning to normal just for, the adults? How about the kids? And at what point are we going to hear their voices? Now, the Afrobarometer surveys that we do, and indeed most of the surveys that we do at IPOR, are looking at hearing the views of people above the ages of 18. And I'm sure, it's the same with Bell, that most of the surveys that we have done on COVID-19 have been with the adults. Now, it would be interesting to also get the views of young people on the pandemic and what their thoughts are, especially when it comes to schooling, because that directly affects them. So maybe that does address, I think, in part the question that you posed, Peter, that my ideal survey, I would want also to hear from school-going children and at what point they think it would be safe to resume school, because we've also had introduction of online classes, I'm sure, in a lot of countries on the continent with mixed impact. But we also know that the issues we are discussing earlier, about mobile phone penetration, internet access, they also have an effect on online learning. That it might just be that the kids from poorer backgrounds, kids that are living in rural areas, they will not be able to have access to online learning options that those in urban areas are having. So it would be interesting for me also to see the effect of COVID-19 on learning and other aspects that we maybe don't traditionally address in our conventional surveys.
Yeah,
Can I
absolutely.
just touch
Yeah, go ahead, Bill.
children? Yes, what Bonnie said brought to light the arguments we've been also having in Nigeria. The government has been asking the question: should we or should we not open schools? But parents are having mixed feelings about whether they should open schools or not, because in schools you have lots of children. You're not sure where they've interacted, and you never can tell what will happen. But I think the key response to that is how fast is the curve, the COVID-19 curve in a country flattening out. In Nigeria today, we have over 24,400 cases, confirmed cases of COVID-19, over 600 deaths, and over 10,000, discharged people who have been discharged from, from the COVID-19 centers. So the question is, are the numbers coming down? Is the curve flattening? If the curve is flattening, then possibly it's time to get the children back to school. But if the numbers are still going high, as we have it in Nigeria, there is even talk about imposing a second phase of lockdown. But the government is considering between, can we cope as an economy? If we impose a second phase lockdown, how are the people going to survive? So these are some of the sort of policy angles and policy issues that government and the people need to think about with respect to COVID-19.
Yeah, absolutely. And I want to, I'm going to put up a quick comment here from Hazel, just very briefly. Hazel is joining us from Zimbabwe. Pascal, who asked the question about the youth and the children's perspective, is also from Zimbabwe. Hazel also says, I'm glad that we're finally talking about the neglected issue of mental health in this conversation and measuring and understanding it in a more direct way. So Hazel also is very much on board with that. So to you, Bonnie, as we closed out, you gave us some indication as to your ideal questions or the important voices that need to be included and measured. Are there any other areas that you would like to add in your ideal survey?
Well, I mean, obviously my interest is on the nexus between COVID-19 and governance. And again, maybe I'm a bit biased here in the Malawi context, that we have a new government that a few months before maybe downplayed the seriousness of COVID-19. How then are they going to convince the ordinary citizen to start to take COVID-19 seriously now that they are in power? And indeed, what do the citizens want their government, the new government, to do in addressing COVID-19? Putting on my Afrobarometer hat, I would also want you to know the views of African citizens, especially on some of the African cures of COVID-19 that Bello has alluded to. I know that Madagascar, for example, has been promoting a herbal cure on COVID-19. It would be interesting to hear from citizens across the continent on what they think about this kind of local cures, because sometimes I think this kind of discussions also drift towards thinking about neo-colonialism and how some of the local cures, especially those that in quotes have been generated on the African continent, tend to be quickly dismissed. But what do people think about this, especially when you have herbal cures that have not been scrutinized through the normal scientific processes? But again, it also reminds me of Ebola, the Ebola crisis, when there were vaccines that were being developed, but I think there was an agency, and I think it was to say, let's start testing, not just testing them, but let's start using these vaccines, we cannot afford to wait to, to have all the normal, the rigorous processes of testing to take place before we start using them. Now, it would also be interesting for me to hear what people's views are about this kind of cures, and including, I think, the conversations that Bill suggested about chloroquine, hydrochloroquine and the like that have been promoted elsewhere, but without maybe a lot of scientific backing and proof. Now, what do people think about this kind of cures for a pandemic such as COVID-19? But I guess the long and short of it is that I would want to learn more about what do people think about COVID-19 and how it is impacting the governance processes, including the issues of corruption that we've been talking about.
Wonderful. It's great, and I think this is one of the themes of our conversation today, is that surveys are a tool that can get us information on a lot of different subjects. And Bonnie, I'm glad you brought in the issue of the local cures. And I really liked how you framed it as well, this discussion about in the context of neocolonialism in the debates. And I know in the podcast you participated in recently, you reflected on that a bit. But it would be really interesting to see how citizens are interpreting this debate for themselves and including their voice in the conversation. So I want to thank both of you for joining us today. It's been a real pleasure on my end. So I want to thank you, Bonnie, for joining us, again, coming to us today from Malawi, representing himself, obviously, as well as Afrobarometer, wearing that hat, as well as the hat of IPOR-Malawi. And also I want to thank you, Belle, for joining us from Nigeria and putting on your hat of the Africa Polling Institute, as well as all the different projects that you are also involved with, including the Smile Africa group. So thank you to you both. I'm really happy also our connection on our technical side worked out fairly well for today's discussion. So we always have to have our fingers crossed. So thank you to you both.
Thank you very much, Peter. And thanks, Bello, as well, for your excellent insights. That also made me think long and hard about my own position here.
Thank you, Bonnie. Thank you. It's always a pleasure connecting with you. And nice really connecting with Peter. Thank you all. Thank you.
Thank you. And thank you for joining us today on Leaders of Africa Live. We thank Bonnie and Belle for sharing their experiences and perspectives on conducting survey and bringing up a lot of things for us to help brainstorm about doing research both ethically and safely. We also had a broad discussion about a lot of different things, from mental health to elections, to broader societal matters. And so we can see that this period of COVID-19 is not only a period of challenge, but a period of opportunity, not only in terms of the things that we study, but also the approaches that we take to doing things such as survey research, thinking about telephonic surveys, for example, and even online panels, obviously with the cautions that come with those methods. Let us continue the conversation. Stay tuned for our next live conversation in 2 weeks. Our next live conversation examines fieldwork and results emerging from research related to agriculture and food security, one of the topics that we talked about today, in fact. To receive a reminder, subscribe to the newsletter and our new YouTube channel, like our Facebook and LinkedIn page, and join our Telegram app group. And so again, on my behalf and on behalf of the panelists, thank you for joining us. We look forward to seeing you again. Until next time.